Lib Dem spokesperson Paul Kohler.
Thank you, Mr Betts. It's a pleasure to serve under your chairmanship. I would like to thank the member for Wokingham for securing this important debate. As so many have said, and Lord Darcy confirmed, our NHS is in crisis. Spiralling waiting lists, crumbling infrastructure and demotivated staff are symptoms of the mismanagement that was all too common under the previous government. The current state of cancer diagnosis and treatment is testament to their failure, where a lack of vision and strategic thinking has let patients and families down. Under NHS guidelines, 85% of cancer patients are expected to wait no longer than 62 days between referral, as we've heard, and the start of treatment. Last year, less than 65% did, whilst this year it's shaping up to be even worse, with on current trends in excess of 100,000 patients failing to begin treatment within that time frame. This is simply not good enough. The UK is a global hub for life science research, and yet we are lagging behind many countries without that expertise when it comes to applying the very research we often pioneered. Whilst cancer research is a top priority for the UK, we must aim to lead the world in outcomes too. As the Health and Social Care Select Committee made clear earlier this year, that requires a long-term strategy with innovation at its core and a more integrated, forward-looking approach to cancer, ensuring that research, policy and delivery pull in the same and not opposite directions, in contrast to what's currently a much too fragmented system. In my own constituency in Wimbledon, there are particular concerns around breast cancer, where early diagnosis and treatment is critical. Across Merton, the London borough within which most of my constituency lies, breast cancer screening rates are significantly below both NHS targets and the national average. In 2022, less than 57% attended screening when invited, significantly lower than the 70% national standard required to make screening truly effective. Behind these statistics are lives and families, of course. When breast cancer is diagnosed and treated at stage 1, survival rates are close to 100%. But lower uptake of screening inevitably leads to later diagnosis, with a commensurate decline in survival rates. That is why my council colleagues and I have been campaigning for NHS England to provide a breast cancer screening site in Wimbledon, which currently lacks the screening infrastructure necessary to meet national screening targets. When I attended a Radiotherapy for Life session in Parliament recently, I heard similar concerns about the lack of investment across England on radiotherapy. Currently, only half those who could benefit from radiotherapy access it because, in the words of the medics I spoke to, this country lacks a cancer strategy. The entire setup is far too fragmented. To take one depressing example, even though integrated care boards are responsible for radiotherapy, some 30% did not even know this was so when subjected to an FOI inquiry. In contrast to these examples, when the cancer referral system is working well, the approach is transformational. 2 weeks ago, in the wake of an elevated PSA level, I was put on the 2-week cancer pathway. 2 days ago, I had an MRI and received a clean bill of health. It took just 10 days to give me peace of mind. Not everyone will be so fortunate, but everyone deserves that alacrity. A more integrated approach to cancer will speed up diagnosis and treatment and improve cancer outcomes. I consequently echo my colleagues' calls for this government to introduce a cancer strategy. Thank you.